everyone for joining in on this webinar. I want to give a big thanks to MedQ&A for sponsoring this webinar. I'm not a medical professional. I'm just giving this webinar just to give you some insights on my perspective. If you're not watching this webinar live and you have any questions, just go to MedQ&A and record your question, and I or someone else that knows about autism will answer your question later on. During this webinar, I'll be muting the microphones to reduce outside noise. Just please feel free at the end to ask me any questions. I'll be more than happy to answer the questions at the end, and I'll unmute the microphone. So my topic is closing the disparities gap. Oh, wait, let me start the slideshow, sorry. Okay, so my topic is closing the disparities gap between access to healthcare for individuals with autism. I'm particularly interested in this topic because I think that health disparities are very important and they're often overlooked. And that it's important that we address these disparities that exist in our society. This webinar will be focused on common barriers that individuals with autism face on a day-to-day basis when utilizing healthcare services. And I think that there needs to be a shift towards providing more accessible and affordable healthcare for individuals with autism and other individuals that are affected by healthcare disparities. Just a little background about myself. I got my bachelor's in arts and public health with a concentration in social determinants of health from Elon University, and I'm currently a second-year master's student pursuing my MPH, Master's in Public Health and Healthcare Management at Emory University. And I'm currently an intern for the American Autism Association. So on the next slide, I'm just going to be giving you some quick facts about health disparities that may affect individuals with autism. So individuals with autism usually have one other health condition. 55% of parents reported that their child had excellent or very good health. So I think that we need to think about the other 45% of individuals that do not think that their child has good or very good health. And unfortunately, families of children with autism pay more for care they received than other kids that have illnesses that require specialized care. So throughout my presentation, I'll be talking about common barriers that individuals with autism may face. That is including geographical inequalities, social and economic factors, communication difficulties, and I'll also be touching on the gap that adults and adolescents may face, and I'll touch upon the gap between genders and health disparities. So the first common barrier that I'll be talking about is geographic location. And that's transportation to and from appointments. And these individuals and families affected by autism may face difficulties when trying to transport to and from appointments. And they may live in rural areas that do not have proper transportation, and these transportation systems may not come close to their residents. So they may have problems accessing care. And these proximity to proper medical care may be a difficulty, especially in rural areas, and this could deter people from receiving care and even seeking care. And rural areas, unfortunately, have less available resources, and there's a problem with diagnosis and treatment in these areas, and there's just not enough people are being diagnosed or treated in these areas. So there's a definite strain on resources and not enough funding. In these areas, there could be one healthcare system for this entire area, and they could be underfunded or overpopulated. And they might not even offer specialized care that individuals with autism need. And individual autism may have one or more health conditions, as I mentioned, so they need specialized care. Another barrier that's often overlooked is accessibility, and that can be such as wheelchair access to, or elevators to appointments. And that's often overlooked. The accessibility into a building can be a huge problem if someone does not have easy access. On the next slide, I'm going to be talking about Gap Map, and that's a system designed to track where autism services are in relation to the amount of people that have autism in a certain area. So as you can see, I'll just tell you a little bit about GapMap. So GapMap was introduced by researchers at Stanford University School of Medicine. And so this map shows the widening gap between the services and the amount of people that have autism and the resources that they need. As you can see in the rural areas, there's a lack of resources and compared to the amount of people that have autism. And even in popular areas, there could be a strain on resources. As you can see, there's a huge lack of resources in the Midwest. For example, in Montana, there's about 4 autism diagnostic treatment centers. And that's a big deal. There's not enough services. And it doesn't mean that people in Montana don't have autism. It just means that there's not enough resources in that state. And just some interesting facts about GapMap is that the average person lives 50 miles away from the nearest autism diagnostic treatment center and 20 miles away for a person who's already diagnosed. And people that live 15 miles away are less likely to be diagnosed. And some people even live as far as 130 miles away from the closest autism diagnostic treatment center, and that's a really big deal. And that can lead to a huge strain on the centers that offer diagnosis and treatment in these areas. So there's an obvious need for more diagnostic treatment centers, especially in these rural areas. So on the next slide, I'm going to be touching upon common barriers, which are social economic factors. And these factors play a huge role in accessing healthcare. And a contributing factor to the disparities that individuals with autism may face is the need for specialized care, as I mentioned before. And unfortunately, there's a lack of specialists across the United States. And services used by individuals with autism are usually more costly. And the severity of symptoms range from person to person. And unfortunately, many physicians are unfamiliar with the needs and challenges specific to autistic patients. So coverage is really critical since families are often forced to manage behavioral and developmental health services for their families. And unfortunately, many families may have to lower their hours or even leave their jobs. And across the board, children with autism use more healthcare services, including inpatient hospital stays and more medication. And ultimately, all these factors lead to more out-of-pocket costs and financial insecurity. And higher rates of poverty are among these groups. Adults with autism are more likely to live in poverty and less likely to have access to quality care, unfortunately. Another factor is race and ethnicity. Studies have shown that there's a later diagnosis for individuals of color, and the chances of early intervention are often missed. And early intervention is crucial for development for individuals with autism. And the graph on the left shows the quality of healthcare provider interactions. And Black and Latino parents of children with autism were less likely than white parents to report their healthcare provider spent enough time with their child or was sensitive to their family's values and custom. So what does this mean? So unfortunately, these people aren't comfortable with their healthcare providers, which may result in missing appointments or just not seeing the provider at all. In my experience, if I don't like my doctor, I would probably switch or just not go back. And another research from Columbia University looked at birth records of children and characteristics of the mother, such as race, place of birth, education level, income, and if she was on Medi-Cal. And just to give you an insight, Medi-Cal is a California version of Medicaid, and Medicaid is public insurance for low-income people. And the findings were very interesting. They found that children in the low-functioning groups were more likely to have mothers who were non-white, foreign-born, less educated, and on Medi-Cal. And in the high-functioning groups, the mothers were more likely to be white, more educated, and not on Medi-Cal. So there's a huge gap between those two groups. And social economic status, race, ethnicity played a huge role in accessing healthcare. On the next slide, I'm going to be talking about the common barrier communications. Individuals and families with autism unfortunately face difficulties navigating a healthcare system that relies heavily on verbal communication. Um, that could include difficulties, uh, problems with insufficient appointment time and communication within these appointments. And children and adult patients need extra time with providers. So it's imperative to properly treat patients and properly communicate with patients. And there's a lack of accommodations for parents or caretakers and for individuals with autism. Problems with communication with providers can make individuals feel uncomfortable and can lead to missing appointments or just not going to appointments at all. So how do we treat and improve access to quality care? Providers can improve with longer appointment slots, since additional time may be beneficial when communicating and processing information, especially with individuals with autism. They may have process information longer than others. Providers can improve on communication. They need to make sure that needs are addressed. And another improvement could be insurances could create databases with autistic-friendly providers. That list could include providers that are more willing to accommodate for individuals with autism. And then a unique improvement could be text-based communication options. So that can provide an alternative option for patients who have problem with verbal communication and interacting with providers. So on this slide, I'll be talking about the availability of services for adolescents and adults and how this gap affects the care provided for adults and adolescents. Unfortunately, many healthcare services are geared toward providing for children. And aging out, unfortunately, is a transition that pushes children with autism into the system for disabled adults. And our system is lacking for disabled adults and young adults. And that provides a strain on the resources that are already available. And like I said before, adults with autism are more likely to live in poverty and less likely to have access to care. And adults with autism face similar coverage limitations, especially when transitioning off a parent or guardian's policy, which can lead to significant financial burdens and just not seeking proper care. An interesting fact is that the average autism services can cost an additional $45,000 a year when raising a child with autism, and that amount increases for adults. So it's a lot of money. And the U.S. cost for autism over the lifespan is $2.4 million with a person with an intellectual disability and $1.4 million for a person that does not have an intellectual disability. So there's a huge gap between those two amounts. And according to the statistics, there's a huge gap between these two groups, and unfortunately, the resources for adults are just not as quite good as the resources for children. There's a gap between genders, like I mentioned, female and male. The most significant research shows that there is a higher rate of autism in males and females. In males compared to females. Girls are more likely to hide or conceal their symptoms when being diagnosed with autism. So how does this affect the health care that they receive? Women with autism are less likely to maintain employment or seek secondary education as compared to males. And this can be a challenge because a lot of people obtain health care through their employment. And education level has been linked to poverty rates, which has effect on health. And women with autism have greater mental health challenges as well as suicidal thoughts. And of course, mental health is just as important as physical health. There's an apparent gap in access to healthcare and diagnosis with between females and males with autism. So how do we improve on accessing healthcare for these individuals? First is improving early access. Improving the rates of diagnosis in certain groups is important, as I mentioned. We can focus on diagnosing girls at a young age, and especially in low socioeconomic status areas. Diagnosis is key to early intervention. And I think that more research needs to be conducted to understand the reasoning behind why these gaps between these groups exist, between males and females, because there's not enough research on why. Um, and early diagnosis and intervention can improve quality care for individuals with autism. Essentially, early detection can improve the quality of life and they can have a better life. And transition programs. So transition programs, schools should continue to teach and help developmentally disabled until they're 25, which can account for delays and help families. Lower education levels has been linked to higher poverty rates. So if we can tackle the education problem, we can tackle poverty among these groups and increase access to proper care. Another easy fix would be local focus groups. I think that's an easy way to help people gain access to quality care. So providing families with support and helping them finding resources that are right for them. Focus groups can provide families with a safe space to communicate with people that may be of the same background, ethnic, racial, or cultural background. We can also focus on groups of women with autism, which is a great way to provide resources about jobs and education opportunities, especially if these groups are at a disadvantage. Groups may provide opportunity to seek clarification and provide a safe space for diversity and inclusiveness. The American Autism Association hosts a autism help hotline, and this provides families all over the world with information varying from autism scholarships and funding to finding therapists, doctors, or schools in your local area. We offer information guides and resource lists available on the website. And if you have any questions, I'd be willing to answer them. I think I'm finished. Does anyone have any questions?
Brittany?
Yeah.
That was a great presentation. You obviously know your material very well. A lot of information.
A lot of information.
Question for you though. Going back to your the map that you showed at the beginning.
This one?
I guess based on that map, there are probably lots of people in these areas that go undiagnosed then, right?
Yes, correct.
Autistic people?
Yeah, a lot in the rural areas. It doesn't mean that they don't have autism. It's just that they haven't been diagnosed and there's not enough resources in those areas to diagnose patients.
And I guess because they're not diagnosed, they don't have the numbers of people, then the resources are not going to be made available to them because they don't have any people there.
Yeah.
Wow.
So there's like I said, there's a huge strain on the resources that are available because in those areas there could be one healthcare system for the entire area, and they could not even offer specialized care that the individuals with autism need. So they're at a disadvantage for living in these areas. But like I said, even in populated areas, there could be a strain on resources because there's a lot of people and maybe not enough resources, like I said.
Okay, great. Thank you.
No problem. Any other questions?
Yeah. Are there any countries that maybe even the American Autism Association have noticed that their handling of autism is a bit better than the American way of handling with it? Like, say, maybe there's more resources, more associations, more things like that.
Well, I'm not familiar with outside of the United States, but I guess I can touch on my own experiences. I lived abroad in Europe for a semester, and I got to travel around Europe to see other, like healthcare providers around that country. And I really thought that they did a really good job of providing different types of people with healthcare. It wasn't just, it's just basically everyone gets healthcare. It's universal healthcare. So I think they do a better job of providing healthcare for individuals. Well, in the United States, I don't think they do a very good job with providing healthcare for individuals of all different groups.
Thank you.
Any other questions?
Yeah. How is it that Montana, for instance, can only have four centers to help people with autism? I mean, correct me if I'm wrong, but isn't it true that there are a lot of women, a lot of young girls who grow up in Montana and other states similarly situated, who maybe they're not diagnosed, but it's clear that not diagnosed with autism, but it's clear they have some type of intellectual disability. So they go through all of their schooling, and then they become an adolescent or a young adult. What happens to them at that point?
Well, at that point, they still haven't been diagnosed, and they might not even know they have autism. And they go through the system, and they probably don't seek post-secondary education. They probably don't even have that opportunity. So I would think that they wouldn't have a stable job. I'm not too sure in Montana, but girls go undiagnosed, and they might not be diagnosed throughout their lifetime. So I think I'm confused by your question. Can you repeat it?
I was just wondering what kind of infrastructure exists right now to help specifically girls who have intellectual disabilities and maybe even also have autism. I mean, and
Well, I think
it's not only when they're at the young girl stage, but when they become an adolescent and an adult. Like, what exists?
there's not a lot that exists. That's what I'm saying. There's not a lot of there's obviously resources for girls with autism, but there's not enough compared to the amount of girls that have autism and the amount of people that don't go that aren't diagnosed. So there's not a lot of research on why girls are less diagnosed than males. It just happened. They're not, like I said, they hide their symptoms better than males.
But when you say they hide them better, it's really worse for them when they hide them better because they miss out on the benefits. Isn't that right?
Yes, they do. Unfortunately, that's just how it is. Yeah, that there's really no infrastructure set up that targets girls. I mean, I'm sure there's organizations that help girls um and there's obviously a need to diagnose more girls, but I don't think that there's an infrastructure just set out to diagnose girls.
All right. Well, then, just another question. If there's a mother who's watching this living in the Midwest who doesn't have the type of resources and access that we in big cities have, and they have, a daughter who's about to become an adolescent, what kind of suggestions can you make for them? How can they get the best care, and what resources would be available to them?
I would say if you're in an area like that, I would go online and seek out other resources in other states because, like the American Autism Association, I would seek out organizations like that because they would know more than I do about resources in my location. And I would say that's a hard question, but if anyone else has any insight on that, but the best thing I would say is to seek out those organizations that have more resources and that can help you seek those resources in your area. Yeah, does anyone else have any insight on what they would do?
Yeah, I do. So my name is Ileana Blasi. I also work for the American Autism Association, and essentially for families in need in more rural areas, a lot of them will relocate if they have the means to do so. Or all public schools should actually provide resources for individuals with special needs. It can be more difficult navigating it because that means they have to have the funding accessible, which a lot of schools won't offer diagnoses because then they therefore have to invest in students more so if we're talking about school or adolescent age individuals. But at that point, it really, there is a lot of pressure put on the parents depending on the time they have. And this is why these disparities exist, because for low-income families, they don't have the time to dedicate to not only working full-time jobs and managing their family life and their children, but also to doing the research and learning to do at-home activities. So, again, that disparity is there, and that's what we're here to talk about. Some parents do have the time to learn about that stuff and then also take action in their local community to gain more access. So from working at the American Autism Association, a lot of families will contact us in seeing how they can get a center started or how they can do outreach in their local community. So it really becomes where parents turn into advocates. And I think that's where this growth of, new resources really roots from is parents taking action.
Yeah.
Thank you.
Yeah, no problem.
Brittany, I'm looking at this map and I'm baffled as to why is it so lopsided? Why is it that there's so many resources more towards the east than there is towards the west?
Well, my first thought would be there's more people on the East Coast in those areas, and in California there's a large population. Like on the East Coast, obviously there's more people, like New York. There's a lot of centers in there, but there still could be not enough resources for people. It just happens to be that Midwest doesn't have a lot of as many resources. I think it has to do with population of the states.
Okay, thank you.
Any more questions or concerns or thoughts? Okay. Well, thank you all for joining in on the webinar, and I really appreciate all the questions. And if you have any other questions, you can contact me directly or record your question for later.
Okay, thank you.
Thank you.
Thank you, Brittany. Good
Good
night.
night.